Hi, my name's Natalie Hu from Hidden Disabilities Charity. Yesterday was POTS Awareness Day, and there's quite a lot of things that are happening in that sector, which we thought would be useful to have a discussion about. So today we have got our one of our charity ambassadors, Dr. Sanjay Gupta, with us, who is a POTS expert. We have got Dr. Dinesh Kumar, who's a GP with an interest in POTS. We've got Dr. Rashid, who is a cardiologist. We've got JJ, who is a pharmacist with a special interest in weight gain, diabetes, and cardiology as well. And we've got Chantel Thomas, who is an IV saline provider. We also have several of our POTS community, our members, our service users. We've got Bethany, Rosie, Ellie, Melanie, and Susan here who are going to give us some sort of lived experience with POTS, and they can talk to the experts as well. So we'll get everybody chatting and see what we can learn and see what directions we can take. So I'm going to start with Dr. Gupta, who's going to tell us what's been going on in the world of POTS at the moment, because there's a lot happening, isn't there, Sanjay? And you've taken yourself off mute. So yes, if you'd like to give us an update, what's been happening?
Well, thank you so much for everyone for joining at the last minute. So one of the things, obviously, is yesterday was POTS Awareness Day. People are becoming more and more aware of POTS, but the problem is there's no point having awareness days if you are not going to develop resources and treatments to make these people better. So, it's fine saying, oh, well, there's this thing called POTS. And what do you do with that? If you go to your doctor, the doctor says, well, I don't believe in it, or I can't help. And there is very little support for patients with POTS. And whatever support there is limited in what it can do for their quality of lives. What has happened more recently is there has been some kind of move to try and dismantle POTS services. And certainly I've been working in York for the last 10 years, so the POTS service in York is going to close. We've been told that. And the reason is the official thing is it's not a commissioned service. The unofficial thing is that people are not interested in POTS. They don't think POTS is something worthy of investment. POTS is not as interesting as prescribing statins or some of the other treatments, which don't necessarily have a huge benefit, but they are within the evidence base, whereas something like POTS, where a condition which is not thought to be dangerous, but hugely debilitating, is not given the importance it's needed because people think it's not dangerous, even though the important thing really is quality of life, and POTS patients don't really have much of a quality of life. And it's a shame that there is this attitude to this. So soon what we will have is a bunch of patients already diagnosed with POTS and others waiting to be diagnosed with POTS who will have nowhere to go. In addition to this, local GP services have now turned around and said, we're not going to be prescribing medications for POTS anymore. So if you're a POTS patient in York and you have been on medications for 3 years and you have improved on those medications, now the GP will say, you can't get those medications because they're off-label or off-license. And actually, the sad thing is that we're very happy ignoring the fact that the patient has benefited for several number of years and not come to harm, yet we're happy to say, now you can't have them because we feel uncomfortable about prescribing them because they're off-label. And you can imagine that this is hugely frustrating for people like me who are invested not only in the condition, but certainly in patients with the condition. So there is going to be this huge unmet need. And it is important that people who are like-minded, who want to make a difference, come together and put their heads together and say, well, how do we address this? How do we make things available to you? if you can't have them on the NHS, how do we make these things available to you in an affordable manner so that you can actually have some hope and so that you can actually have some semblance of a quality of life? And I think this is why Hidden Disabilities has been helpful, because my own personal experience with POTS UK is that they're a complete waste of time, um, because they want to toe the party line and they're uncomfortable about making themselves uncomfortable for the sake of the patients that they're supposed to be advocating for. So I'm grateful that Natalie and Hidden Disabilities are willing to explore other options which may be helpful for patients with POTS. And one of the things, obviously, has been intravenous saline. I've certainly used this in some of my patients, and they have benefited. And I'm really grateful that Bethany is here and Melanie is here, and even Ellie's tried IV saline in the past. And it'd be really interesting to hear your experiences with it, because those stories, your stories, are the most important thing in this. There's one thing about having data and evidence and protocols and guidelines, and there is that other thing about just listening to another human being's story. And ultimately, that is what medicine should be, a simple bond between he who is suffering and he who shall heal. And therefore, I think I'm really keen. I've managed to get some colleagues who are like-minded together, who together collectively we may be able to do something which allows certain therapies to become more affordable, to become more available for the people in certainly Yorkshire. And this is why I think we all got together. We wanted to hear your stories of intravenous saline. And if those stories are compelling and you as the patient feel that this is a valuable thing, then we have to get around and start thinking, how are we going to make these services available for you? We also have Jaya, who's a pharmacist, who at the last Hidden Disabilities event I spoke to, and I said, look, GPs are going to stop prescribing these medications. Where are these patients going to get their medications from? What do we do? Not everyone can afford to go and see a cardiologist privately. And if the GP is not going to prescribe it, how do these patients get the medications? So Jaya, at that point, very kindly offered us rates which were almost the same as NHS rates, so that you could buy the medications privately at rates which were sort of not much more than what you would pay on the NHS for your prescription. So those are little movements that we can make together. When good people can try and get together, we can make things happen and make things more accessible in the face of this kind of lack of empathy towards this particular group of patients from the NHS and from the majority of mainstream medicine. So this is why we're here. And I think it'd be really interesting to hear your stories with the intravenous saline. And if those stories are compelling enough for our colleagues, then we could all sit down and think, okay, how do we do this? How do we make this happen? Um, and Chantel is here. And Chantel, you're doing amazing work anyway. You are giving patients intravenous saline. So you provide us with a potential mechanism of making this available for patients who struggle to travel, who may struggle to pay high street prices, etc. And so this is a really unique opportunity for us to just get together and say, first, do you think it's even worth it? And that has to come from the patients. It shouldn't be about me. It should be about the patients who've tried it. And then if it is something that is worth it, how are we going to do it? And
Okay,
that's
so
what I wanted to.
Rashid has put a couple of things in the chat box. Rashid, did you want to respond to any of that? I'm just going to ask you to unmute.
Oh, thanks for the floor. Yeah, I just have to echo what Sanjay have just said. I think having an awareness is not the same as actioning it. So there's two different things. Awareness is important, but it's come to a point that we got to do something about it. And I'm very vocal about these things, because NHS doesn't actually, it's coming to a crisis situation that we have to stop all these services, and we have to find a way among ourselves where we can get this where we get this thing sorted. Otherwise we'll be in the same, we'll be in a square one. So I think post service have done a great job with the pushes of Sanjay. I think he has worked a lot with local people, local managers, local cardiologists, But I think it's come to a point, it's a boiling point where people are stopping the services. We got to do something at a higher level. And naturally, you've been a great voice for this. I think it has to come from this sort of group.
Okay, thank you. JJ, do you want to say how you can help support? Because I'm just going to unmute you.
Hi, can you hear me? Sorry, I'm sitting in a cafe right in the corner. Ask them to mute the volume, etc. So apologies if you hear a lot of background noise. Sanjay kindly and Dinesh kindly invited me to the Hidden Disabilities charity event that happened a couple of months ago. It was a real eye-opener for me, and I happened to realize that a couple of the patients that Sanjay was treating, I was dispensing their prescriptions in my pharmacy in Bridlington. Unknown about the whole issue that surrounds the political landscape that surrounds the whole clinics, etc. And my input was around meds management. I'm a medicines expert. You talk to me about any medicine, I can give you the advice. I can talk to you about how to take them, etc. But also with my interest in diabetes and cardiology, I've kind of developed this special relationship with my patients who've got heart conditions. And when I came to the charity event, and the stories of the patients have really made me think, what can I do from my part? And as Sanjay mentioned earlier, is that make it affordable and make it accessible. And that's where I've started the journey with POTS patients and Dr. Gupta's patients. And I said, listen, it might sound a bit silly, but as soon as I get a prescription, I'm keen to dispense or speak to the patient, keen to dispense, get it out in the post. And then the patients are like, oh, do I pay now? I said, no, don't worry about it. You know, when you get the medicine, you'll get the details on how the payment works and everything else. So I'm more about patient-centered care. And that's where, my interest and passion is towards. So thank you for having me on board, Sanjay and Dinesh, to be honest, to make a real difference to patients' lives. So thank you.
So if patients are struggling to get their medications that they've previously been getting because of the changes of what's happening in the POTS society at the moment, how can they go about getting the prescription, Sanjay? I know you was talking about helping people by writing some prescriptions for them. What's the process there?
Yeah, I mean, I think, this is going to be a really big problem. I don't know how one goes about it, but I think knowing that the medications are available at an accessible, at a cost-effective price privately is really helpful, because otherwise it would just be a no-go. The question then is who prescribes them. If the GP is saying I'm not able to prescribe them on the NHS, it's highly unlikely that the GP would be willing to prescribe them privately. And even if they did, how much would they charge for that? So these are big issues. I don't know. I mean, I have more recently just started taking people on, just say, look, my workload is huge, but saying, okay, we'll just take people on, register them as private patients, not charge them, and then prescribe, and so that they can continue with their prescriptions that way. And with Jaya, what he's kindly done is he's allowed me to say, okay, please just let the patient approach you directly for your repeat prescriptions. So, the initial bit is just having someone doing the initial prescription. And then after that, the patient can continue to access the medications without being at the mercy of their GP and without being at the mercy of these managers and, these middlemen who spoil everything. So that's the only way I can see, unless we have people like Dr. Dinesh Kumar and people like that who develop an interest around POTS, who can take on some of that role as well. That would be amazing, because then it's not just, there's more people who can who can prescribe the medications. That would be a good way forward. And that's why it's been so good that we have fellow members of the medical profession here who could potentially help us.
Can I just ask the service users then? Is there medication that you have struggled to get because it's not usually used for POTS, so it hasn't been officially approved? Is there medication you're struggling to access because it's so expensive? Would this be helpful? Would any of the service users here like to comment on the pharmacy side of things and accessing?
Okay, aren't we?
Ellie, did you want to say something? You need to unmute.
Hi.
Oh,
Can I
Rosie
say
wants to say
something?
something. Hi, Rosie.
Hi. So yeah, the one thing that we've been struggling to access is the LDN. Dr. Gupta prescribes it for me, but the problem is it's not expensive, but it's not also cheap to buy each month, and we have to, it gets shipped to us and it automatically gets charged from my bank account every month, and it's not too expensive, but the problem is we kind of have to budget it into our other medications as well. As like I've been recommended to start a IV Saline, and that's very expensive. So it's just trying to find the money for all of these different things. It's quite complicated. So I don't know what else to say. I'm sorry, I'm
That's okay.
nervous.
How
I
much,
suppose
do you
it'd
know
be
how much that
interesting.
normally is, Rosie?
The LDN's not bad. That's about £22, I think. So we can usually do that. But the thing is, I'm having to see a lot of other doctors privately because my GP just won't refer me to specialists. So we're having to like try and save up so much money just to get me to be able to see these doctors. And like I've been refused a rheumatology referral 3 times now because of my POTS and my Addison's disease. They won't see me because of my other conditions. So we've been trying to save up the money to get me in to see a private rheumatologist, but then we're also trying to save up the money to start paying for IV Saline for me, and it's just a lot when it all adds up.
Hmm.
Could I ask, I mean, I think both Ellie and Mel, you've got experience of intravenous saline. Do you find it useful at all? Has it been something that has helped you? It'd be really interesting to hear your opinions for the likes of Dr. Kumar and Jaya and Chantel. Obviously, Chantel's already got some experience, but it'd be interesting to hear what you think.
So I find it helped me a lot with my energy. I felt more awake and with it, and I was able to do a lot more than I would have been able to without it.
Well, it gave you a quality of life.
Yeah, it helped mentally as well.
And we couldn't have had them tasters without you. So it's massive, absolutely massive. But it's affording it to continue it.
Mm.
We are limited in this area. So that's the big problem, because I know it would make Ellie have a massive quality of life that she hasn't got now. She's got nothing now apart from the disability charity and Natalie and you, Dr. Gupta. That's it. We've got no support from anywhere else.
So how has it impacted you, Ellie? How the IV Saline, when you say it improves your quality of life, give us the details. What does that mean?
It just made me feel normal. I wasn't as fatigued. My brain fog wasn't as bad. Just all my symptoms were eased.
And even for a short period of time, that is massive.
How long does it last?
I think it was about 3 days, wasn't it?
Yeah,
But
3 or
that's
4
3
days.
days out of all these
I know.
years that she hasn't had of feeling a normal 23-year-old.
Mm.
Not going anywhere, not doing anything, no friends, nothing.
Was it quite instantaneous, or was it the next day, or?
It was the next day, but you definitely felt the difference.
Mm. Yeah. Bethany's going to come on and say as well. Melanie, you've been having it for a year now, haven't you? Can you unmute?
Yes.
Yeah.
There we are. Hi everyone, firstly thank you for this opportunity. Yeah, so I've been having weekly IV fluids for just over a year now. I do fortunately get them on the NHS, but I have got other health complications as well. Like the other lady said, the dramatically changed the outcome of my life. They've made me go from being completely bedridden to now being able to function for a good 3 to 4 days after having the IV fluids. I now have a port catheter as well, fitted for easy access, because that became a problem. Getting the access every week. It helps my cognitive function. It helps my bowel, because I have neurogenic bowel dysfunction. It really helps with my headaches. I was suffering with severe debilitating headaches daily. It helps with my pain. I suffer with ME and dystonia, and it actually helps with my pain. Helps with my bladder function. I've not had any infections or anything in my bladder since I've been having them, and it helps with my POTS syndrome dramatically. I feel like my heart rate isn't as elevated as much, because, and I don't feel like I'm like laid with a stinking headache, that dehydration feeling of no energy, and the thumping head at the back of my head. It just helps massively. Like the quality has improved, I'd say 100%. I can't fault it at all.
And it helps with your hearing as well. I remember when you first started having it done.
Yes. Yeah, I do get a lot of dizziness. The dizziness is horrendous, and that's one of my main reasons how I know that I'm ready for a topical fluid. After about 3-4 days, I get really bad the tinnitus, ringing in my ears, and dizziness and nausea as well. And it really helps with the ear pain. I guess when I'm dehydrated, it really affects my senses, and it helps with that. Even my eyes and my ears get really, really dry, and that even helps with that.
Yeah, so huge difference then.
Massively.
Ellie, what sort
And
of...
my emotions, it's really helped me emotions as well. I think when you're tired and you're drained and you're dehydrated, your heart rate's all over the place. You have some fluids, and it just makes you feel like you're in such a better place. You feel like you're human again. It sounds silly, but you do feel like you're human again.
Ellie, what percentage improvement would you say?
90%.
Really? Massive
Yeah.
then. Rosie, have you had IV Saline?
Never had it like specifically for my POTS, but I've had it in hospital a lot. Like usually when like I've ended up in hospital a lot because of suspected adrenal crises, but it turns out it was actually my POTS that was causing the symptoms, and they've always given me fluids, and I honestly felt better for days afterwards. Like it kind of at first when I'm getting fluids, I always feel awful. Like I go cold, I go shivery. I like basically beg them to stop it because it makes me feel so bad. But then the next day and for the next few days, I actually have energy, and I can, I can get out of bed, and I don't feel like I just want to get straight back into bed, if that makes sense.
Yeah.
And I feel like, oh, I can actually do something today instead of just getting up and then having to rest on the sofa for 2 hours because I got out of bed.
Yeah. Okay. So, Chantel, I presume you'll have heard this over and over.
Absolutely. I always remember our first client for IV Saline, and that completely opened our eyes up in terms of the actual power that IV Saline has over these patients. Not only was it my mum, but also somebody else, obviously confidentiality. We can't go into much detail. However, we have a partnership with Preston Royal Hospital. And our company logo and kind of what we do is on the TV screens there. And this individual actually saw our advert, came to us, was obviously in A&E due to her POTS, came to us and kind of broke everything down to us in terms of how it benefits her. And just like you guys, you service users have today, it truly just brings a tear to your eye when you don't quite understand And then that's how obviously me and Dr. Gupta got in touch with each other. And since then we see a new client every week, and slowly but surely we are trying to make a difference for all of the community.
Thank you.
And you just so everybody understands, you do pop-up clinics, do you?
We do, yeah. So we've got a headquarters based down in Blackpool in the northwest, but we do pop-up clinics. Now, to find a pop-up clinic in some locations is a lot more difficult than others. We do have one that runs on a monthly basis in Glasgow and a monthly basis in Liverpool as well, and a couple of others in Blackburn and that kind of area. We are trying to grow. We are trying to make more pop-up clinics because we know that high street places like London, Manchester, and those kind of areas are where people are charged ridiculous amounts of money for their saline. Realistically, that is not affordable and can sometimes mean that you're not putting yourself first. Sometimes, some patients can't even afford food from when they were used to have to do that. So yeah, slowly but surely we are trying to make ourselves nationwide to help absolutely every single one of you.
Yeah, so we had a chat the other day, didn't we, about what you would need to be able to do a pop-up clinic in Hull, in our area. And do you want to explain what is that you need setting up?
Yes, so essentially what we are looking for is a room. Basically just a room. What we want to do is create a really nice environment for clients, so you can meet new people if you want to, you can lie down if you want to. There'll be kind of beds and stuff at the clinic, very similar to how if you all went to the charity ball and you noticed the room that Natalie had organised with like the beds and a relaxing environment and that kind of thing. Obviously it needs to be clinical so we can legally kind of carry out the IV saline, but we want to create the POTS community, and we want you guys to speak to each other, tell each other how you benefit from it versus another, and essentially just create a really nice environment for all of you. So what we're looking for is ideal and realistic rooms where we can work from, where there's enough space. Ideally there's hard floors in case there's any spillages and those kind of things. I could go into detail for quite a while about what it is that we really want, but essentially overall what we want to do is create a really nice comfortable space nationwide for all of you to come to for your IV saline at a very affordable price as well.
So you're not local to us at all, are you? So
No.
when we was talking, you said you need a minimum of 4 patients, don't you? That would book in at the same time, and there'd be 2 of you attending, and you'd have 2 patients each that you would be looking after. And that would take between 1 and 2 hours for 1 bag of IV saline. Yes, and then we could rotate it, so then we could have another 4 people, or if somebody needed more than 1 bag, they would then stay a bit longer. Is that about right?
Absolutely, yeah. So we have kind of asked our clients that come to our headquarters in terms of if they were there with 4 other patients, would they want to communicate with those patients? And it is 50-50. Some people prefer their full, privacy, if you will. So what we are planning on doing is creating almost private little rooms. But alternatively, what you can do within that room is you can all sit around a coffee table whilst you're hooked up to your IV bag and chat with each other. We want it to be relaxed. We want it to be, like I said, clinical. It completely depends really in terms of what the actual patient kind of wants. As we all know, everybody's different. You might be having a really bad flare that day where you don't even have the energy to discuss or speak to anybody, and you might just want to sit there with your headphones on. So we want to make it as nice as we can. But yeah, what we would need is a minimum of 4 patients for us to warrant travel into that area.
Yeah, which is easily doable.
Yeah.
Bethany has arrived, so Bethany, I'm going to ask you to unmute, honey, and then if you want to tell us what your experience is with IV, because you haven't been having it for very long, have you? I believe you've had 4. I might be wrong, but do you want to say how the impact of it?
Yeah. So for me, it's been really useful. It basically just gives me a boost on top of what I already have. So if I come in feeling really bad, it puts me back to my normal. And if I come in feeling normal and it makes me feel actually well, normally I drink as much water as I can and I take electrolytes and I have a high salt diet, but I'm still always really thirsty and dehydrated. So the IV, it helps me with energy and brain fog and pain relief. And I feel like it's really helped me start to have more of a life again. And I'm able to start doing musical theatre and go back to university. So yeah, I'm really optimistic about it all. Yeah.
And you didn't want to do it for a while, did you? Can you explain why that was?
Yeah, so that was for money reasons because I was worried that it would be really helpful and I'd get used to it and dependent on it, and then I wouldn't be able to afford it and it would get taken away and I'd have to readjust to that. And I didn't think I'd cope with that.
Yeah. And how quickly does it help?
It depends how tiring it is, getting there. Because if I struggle to get there and to do the stuff, then it takes a while to kick in because it's tired me out getting it done. But when I'm feeling well and I go, then it kicks in pretty immediately, really. So yeah.
How long does it last?
Well, I feel like I get a big boost at the beginning and then it just sort of gradually tapers out. Yeah, I think it's definitely like completely gone after a week, but it's quite a gradual sort of decrease in effectiveness. So it probably does take the whole week to be completely gone.
Right, okay. What sort of percentage? Everybody else has sort of said what sort of percentage they feel like it has improved their life. What would you say?
Oh, it's really hard to evaluate because it's so much better on the first couple of days, On the first day or so, I think it boosts me probably 50%. And then just a bit less throughout the rest. So probably 25% on the other ones.
Okay.
As in an increase, so that'd be like 150%, So because it's 50% better, not, half.
Yeah. So is it quite exciting to have tried it and see the improvement?
Yeah, it is. It's really exciting. I just don't want to get my hopes up too much,
Yeah. So from what everybody's saying, it is really transformative, the IV Saline.
Yeah.
Yeah. And it is basically salt water, isn't it, Dr. Gupta?
It is. But there is something about putting it directly into the veins where it's needed. I think that, yeah, I mean, if you go to a hospital, they'll say, well, why can't you just drink water? Because it doesn't work. Drinking water is fine, but you have to listen to the patient. We can't be listening to conversations in our own heads about why can't they do that. Well, listen to the patient. The patient is saying this works better. Let's get on and just listen to the patient and treat the patient. Treatment is not difficult as long as you're willing to listen to the patient. The patient will give you the answers. But the problem with the way things are at the moment is doctors seem to intellectualize things. They want to seem to work it out in their own heads, and they disregard what the patient is telling you if it conflicts with what they think they know. So if it doesn't match with what I think I know, then you're mad.
Also, sorry to interrupt, Dr. Gupta, but also we're all pretty much guideline and protocol led, rather than patient led and symptom led. I feel like it's all boxed up on a algorithm, pretty much dictated by the commissioners, and the real medicine, as you earlier mentioned about to be healed and whatnot, or the one he's healing versus the one needs to be healed. That conversation doesn't happen anymore in real world, and that's where the world I see the NHS is failing in itself, that's a different story. But yeah, this group of patients certainly don't fit any of the guidelines, don't fit any protocols. Hence, it doesn't exist. That's what the argument that we have at the moment. So yeah, sorry to interrupt, Dr. Gupta. I felt compelled to say that because I hate when patients come back to me and say, oh well, the doctor said it's not there, or he's not listening to me because it's not part of the guideline, etc. And I do with a lot of my diabetes patients, where there's one particular medicine, only if your BMI is above certain criteria, you can get it prescribed. And I'm thinking, well, actually, not really. That's what the figure that's been put by the NICE and people who commission for it. But for the patients, it does really benefit it. So, yeah, so there we are. Sorry.
No, don't apologise. Thank you for that. I know Rashid said about doctors feeling vulnerable as well as POTS patients. Is that linked to this, having to stick to protocols, Rashid? Oh, you don't have a good signal. You're a little robot.
No, I'm so sorry. Okay, I'm going to try.
That's better. Oh, he's going to try. Dr. Kumar, did you have any thoughts on this?
Yeah, I mean, I've been listening patiently, but yes, look, I've got first-hand experience with POTS patients because as a GP, they come to us and they present their symptoms and their life stories and everything. And unfortunately, not having much experience about POTS, only heard about it or experienced few patients, but didn't know what to do. So when we ask for the help, there are not many people know about it or not much help around, and especially around this area. So we struggled ourselves that what we can do. And I've seen so many patients, and they are Dr. Gupta's patients as well. So I started talking to Sanjay. I tried a couple of times. I went and sat with him a couple of times in York. We really begged York Hospital that can they allow me to be there? Can they fund a bit of money so that, of course, if I go there, I need something to cover my expenses, and can I sit with Sanjay and then start doing some of the clinics, at least some of the stable patients I can look after, because if Sanjay can see initially, like of course as a GP I can't really see a patient as a first hand, but once Sanjay has seen and started the treatment, can I do the follow-up clinics? They don't need to go to the York. They could come to Hull, Beverly, or Burlington. That's where I work and I'm based. So all the thoughts were there. And after writing so many emails by Sanjay here and there, nothing really happened. And now I'm hearing the stories that even Sanjay's clinic are going to be shut. So it's really a shame that as a GP, I'm already very busy, but I agreed to do some of the workload to take over. But we are helpless in a way at the moment. So we have to come out with some different ideas and things. For the moment, we discussed with Jaya and we are trying to sort out the medications. That is the first step. And I'm not sure how things will be, but I need to speak to my own insurance and things that whether I could do some of the work. So whether I'm covered from insurance point of view. Now, coming to Chantal's as well, I can help probably trying to set up a clinic, not clinic for her, probably in Beverly. So I know a dear friend who got a, GP surgery. And there is a possibility that there could be a couple of rooms available. So it's a clinical setting. All the requirements will be fulfilled. So it's straight away starting a clinic if everything go well. I need to find out what days it could be available, or whether it is possible even over the weekend. So if Chantal could arrange over the weekend, then that may be the most suitable, time. So it's in the heart of the Beverly and equally accessed by, I think, Burlington, Hull, and nearby areas. So that could be a nice start. So give me some time and I'll come back with those things to Chantal or to you or via Dr. Gupta. In terms of whether I can look after, we'll see. I mean, me and Sanjay have been talking for some time now that how we can resolve this. So once the final outcome from his clinics or from York or whatever, then probably we'll take some actions and see whether I can get involved and start doing some of the patients directly. So, yeah, I think I've attended a couple of, the last 2 years, all the sports, event. It's really an eye opener that how patients really do suffer. So before knowing much about the POTS, we just thought, can it be just anxiety? Can it be just like, patient just pretend, or whether, all sort of diagnosis you come in your mind without knowing that what exactly it is and how it can affect somebody's life. But after going to these events and seeing some of the patients, I really have changed my, completely thought process towards these patients, and I have all empathy, sympathy, and I'm happy to do whatever I can or we can share. So yeah, thanks.
That's great. Whereabouts are you based?
Well, I live in Hull, but I go 2 days in Burlington and 2 days in Hummunby. So these sort of areas I cover.
Yeah.
And so, yeah, I know Hull, Beverly, Burlington, and up to Hummunby now very well. So I've been in this area for the last 20 years. So yeah.
Yeah. Well, that sounds wonderful. Wonderful that you've changed your mind and understanding the POTS patients better, which is great for everybody to hear. And wonderful that there potentially Beverly could be a clinic. We do have quite a lot of members who live in Beverly, and Beverly is accessible. So that would be a good venue.
Yeah.
We're just chomping at the bit here. We want to crack on and get it organized as soon as we can. Has anybody got any thoughts on that?
Yeah, I think it's an excellent idea. I mean, I think the most important thing is just to get something even as small as possible. In Chantel, we've got the person who can do it. Hopefully, if there's a premises, just getting it done would be really good. I am so invested in this, Natalie. When we were talking yesterday, didn't I say that I would actually put some of my own money to subsidize the fluids for patients who can't afford it so that they can access it? Because this is the difference we can make. This is the difference that we crave for in our lives. This is the thing that we're going to sit back on our deathbeds and think, okay, I did something for my fellow human being, for my community. And therefore, my concern is it's better just to get something started, and then word of mouth, and it will build up, and problems will arise, and we'll solve them, and we can. But the fundamental thing is, if we don't get started, if we hope for everything to fall in place, we'll never get that. And that's why I think all we need is some kind of agreement that, oh, great, Chantel is here. We've got some patients who receive IV saline who also have other friends, etc., who probably are either paying lots and lots of money for it, etc. And if we in our own minds have an agreement that, okay, well, let's just get on and let's just, so that Chantel feels that it's worthwhile for her. And then the patients can see what Chantel has to offer, and let's get it done. And we'll solve all the other problems as time progresses.
We also talked about doing some sort of monitoring it, didn't we? So that we could evidence it a little bit so that other people would take it more seriously.
Yeah, I mean, the first thing to my mind is, it's very interesting. I just want to share this very quickly with you. I have about 8 patients in York who were terrible, couldn't do anything. One woman had had attempted suicide 3 times because she felt so awful, and she had 2 school-going children. Anyway, we gave them IV saline quietly in York, and they received that for about 3 years. And virtually all of them got better. Their hospital admissions dropped, their A&E attendances dropped. All we would get from them is Christmas cards, thank you letters. I don't need my wheelchair anymore. Thank you. Today I celebrated my child's birthday. I was able to host the party. Last year at this time, I was thinking of taking my own life. This is the feedback you got. A rheumatologist in our hospital one day just turned around and said, these people are taking too much space. I want to give my injections, rheumatological injections. This is not evidence-based. Stop it. it got stopped. So at that point, when it got stopped, these poor patients started getting worse again. So now you're getting letters from them saying, look, I've had to go back into my wheelchair. You know, please help me. Please help me. So I thought, okay, well, what is the issue? They said, well, it's not evidence-based. I said, okay, let me produce some evidence. So I went and I counted the number of admissions these people had before their saline and when they were getting the saline as a means of showing the evidence that people want to see that this is something that works. And I was able to demonstrate to them that the number of hospitalizations and A&E attendances had dropped by 78% when they were receiving the saline. And I said, well, here's some evidence. And they said, ah, right, okay, that's good, that's very good. Now you need to do a trial because, you know, you need better evidence. And I said, well, why do I need better evidence? Well, and they said, well, because, you know, to do something, we need evidence, but I'm not doing it on anyone else. I just want these 8 people to get their saline. Why do I need any more evidence when those 8 people are showing me that they're better, when I can look at their data and see that they're better? And so the point is this, that although evidence is a great thing where we can actually use it, publish it, demonstrate so that the whole world can look at it and say, oh, this is a meaningful thing. My immediate concern is the people around me. My immediate concern are people like Rosie and Bethany and Melanie and Ellie. Those are my people. And I don't want to wait 2 years or 3 years or have some reviewer turn around and pass judgment over what I should do for those people that I care about. So I want to just get it started.
Agree. We need to be providing something now. We need to make it accessible.
Absolutely. And everything else can happen later. And actually, you will find that once we get it, these very people, these researchers who scorn these patients will come to us, say, oh, I'd like to learn a research study now. Then they'll all jump around us, you know, like people do. But I have never been someone who wants to be interested in personal gain here. My joy comes from the validation when Mel sends me a message saying, I felt so much better. Those are the things I'll remember, right, Mel? You remember that? And when we spoke to Rosie and Ellie and you know, I mean, you know, the grace and the resilience, those are the things. That is what I am. And therefore, I agree about the fact that we want to collect data, etc. But as you say, I'm very keen that we just get our people over this and get them and show them that there's some light at the end of this horrendous tunnel that they're having to face.
Yeah, I totally agree with all of that, Sanjay. The evidence I thought would be helpful for other POTS patients, not necessarily for the research side of things, but within the community, so they can learn from each other and have the confidence to give it a try. I would like, I don't know if we're going to be able to, but I would like the charity to be able to do a taster session. But if we can, then we could at least help organise it and we can signpost. So one way or another, we will be able to support and get everybody together. I'm really happy to put information on it on the website, but I think if we could have some case studies or something like that, where some of the members could share, you know, like and talk about how it's helping, and get the information out there. I think the more people who know about it, the more people are accessing, the more likely it becomes that it will be taken more seriously. And it might take quite a while. Did you want to say something, Susan? You look like you're
yeah. How about, I mean, for Ellie likes to write things down and her feelings and things. So what about a diary?
Yeah.
If you can do a diary of how they are before, right through, then there's the evidence for everybody to have.
Absolutely.
It's there, black and white. We need to do something because it's just so wrong.
Can I suggest maybe a video as well? Like, for example, if somebody is so lethargic or like, you know, what they are day to day, but since they have the fluids in, how really they change? Maybe a small clips of video that what they can do and what they can't when before and after, maybe something like that.
Yeah, that's an excellent idea. Melanie's already been collating information.
Sorry to interrupt.
Sorry.
I love that idea, because we actually have a young girl who comes for IV saline, and every time she comes, she arrives in a wheelchair and she walks to her car. And it's honestly incredible. Her father brings her, and to get that, like, I could literally tear up just thinking about it. She is incredible, and she really, really does benefit from it. So I completely agree in terms of those kind of video diaries, in terms of documenting how it actually does appear.
Well, we could, yeah, I mean, and we could put that on our website. And Dr. Gupta, you've got a big following as well, haven't you? So, you know, we can promote this information, you know, if people pull it together for us. Melanie, do you want to tell them some of the things you've been doing? Because you've been very proactive with this, haven't you? You need to just come off mute. Hang on, you're still on mute.
Unmute.
Anyway.
Apologies. Apologies. I'm tired now. Yes, I've been the last just over a month now. I've been trying to get somewhere with having my IV home fluids that I have weekly at home. There is actually a protocol in the hospital that does provide home IV fluids, but unfortunately it doesn't fall under the cardiology, stroke, POTS patients criteria. It does fall under the category of gastroenterology. Is that the right word? I'm tired. So yes, I've been working through that, and I've someone's getting back to me on Tuesday regarding coming to my home to do some training to access it myself via my POTS. So I'm not wasting a bed in hospital for 4 hours every week. I've had a bit of a to-do in the hospital as well, with the attitude of one of the sisters on the ward referring to me as just coming in for fluids, which really upset me. She's been making that comment the past couple of months, as if I don't warrant coming in, taking up a bed just for fluids. So I very nicely approached her on yesterday, and basically said, like, does she understand POTS? Does she understand what the benefits of saline fluid does? And she apologised and said, I really am sorry. I didn't realise how much POTS affects somebody's quality of life. She actually didn't really know what POTS was, even though she'd been treating me for well over 6 months on her ward as the sister on the ward. So I said, what do you think we could do moving forward? Would you like me to get you some information on POTS so you can look at it, research it, and see how much it improves patients? And she said, yes, please. She apologised and said she was going to go away and reflect on it, and was looking forward to looking up how POTS affects patients and how IV fluids improve quality of life.
Okay. Dr. Gupta, you're doing a leaflet, aren't you? For us.
Yeah,
Well,
I
not
think
just
so.
for
And
us, but for POTS patients.
yeah, I think what I'm going to try and do is, over the course of my working with patients, I've met lots of interesting people, lots of helpful people, lots of people who have that same mindset that they want to actually be patient-centered and work for the patient. You know, you don't treat conditions, you treat patients. That's really important. You know, a condition doesn't have an identity, a patient does. A condition doesn't have dreams and aspirations, and a patient does. And I think that's really important. So what I've done is that, obviously, you know, there's Chantel, there's Jaya, there's you, Natalie. And what I want to do is develop a little booklet which I can give to every patient, not only private patients, but NHS patients, which has all these resources, that here are people who can help you, because they're not going to see you. They're going to be able to see you in a different way than you have been seen or unseen so far. So making medications available cheaply, having a general practitioner who has an interest in this, or who's not going to fob them off. Um, there's a physiotherapist who's happy to talk to any patient free of charge. So compiling these resources together, and then also speaking to sort of stocking manufacturers about discount codes, electrolyte manufacturers for discount codes, etc., and putting them all together and making that available to every single patient free of charge, I think would be a good thing. It just is the part of that patient empowerment thing that I'm very passionate about.
Yeah. And we're going to put some of this on the website as well. I'm not sure if we're going to get kicked off from the Zoom link. May happen because I think I put in an hour and a half, which we've been an hour and a half. But just to summarize, so IV Saline, Chantel is going to be setting up pop-up clinics in Hull. We need at least 4 people. I will give you more information on that. I know some of you will be interested. Dr. Gupta is wanting to obviously help get involved and promote and recommends the IV Saline. We've obviously got Dr. Kumar here who is interested in getting involved with POTS as well, which is wonderful, and the JJ who is going to help make sure you still get your medications. But Dr. Gupta, you're going to have to help explain how we will go about that process, and the same with Chantel as well. So these are things that it was just a discussion today to find out how are you thinking on it. I'm presuming you would find that very helpful to have some facilities in your local area where you can go along and have your IV and be able to access your medication yourself, so you're more independent at a more affordable price. Does anybody want to comment on any of that?
Yeah, I just want to say that POTS UK have turned around and issued this thing where they say that we don't recommend IV saline because there's no evidence it works. We've heard that it does work, at least for the 3 people who have told us, and those 3 people would have been deprived of that benefit had we taken this kind of blanket kind of, oh, it doesn't work, or there's no evidence, therefore it's not recommended. So again, just goes to show we have to be courageous enough, we have to be brave enough, we have to rely on our own observations and what people tell us, rather than some organization which, and the problem with a lot of these organizations is that they start with good intentions and then they become about self-preservation. And so it's very important that we do something different. There's no shortage of organizations. There's no shortage of people wanting to talk about POTS. It's fashionable. It's cool. But what difference are we going to make for the patient? That is the important thing. That's what we want to do.
Yeah. Can I, Chantel, I don't know if you've had many POTS patients. I know you do your IV saline for lots of different conditions. Have you had many that you've used it for POTS?
Yeah, off the top of my head, I'd probably say that we've had around 25 POTS patients so far for IV fluids. On that, what we actually carry out is our own case studies. So behind the scenes, I've been doing quite a lot of research in terms of potentially, I was speaking to you briefly about it yesterday, Natalie, about potentially getting some NHS funding for POTS, in terms of maybe releasing a project in terms of us all coming together as a community and saying this does help our POTS. And IV saline to be on prescription would probably be cheaper realistically than your statins and that kind of thing. Or, we can definitely push for that. It is not an expensive drug. It's not even a drug for that matter. So what we've been doing is we've been carrying out the Warwick and Edinburgh scale chart. I don't know whether any of you are familiar with that. It's a well-being graph chart that we can put forward to NHS fundings to essentially say that this is helping our patients, and pulling together as many case studies as we can with figures as well. So things like taking patients' pulse before we administer the IV fluids and the patient's pulse after the IV fluids. Most of the patients with POTS that come and see us, and most of you will probably agree, you've all either got the watches that monitor your pulse, or some of us have got like the fancy kind of straps that go on your chest and that kind of stuff. So we do monitor as much data as we can, and hopefully when the time's right, there's not so much that I can go into detail about it at the moment, and I've not even briefed Dr. Gupta on this yet. However, it is something going on behind the scenes that we are doing to potentially gain some funding for POTS.
That sounds fantastic. I mean, there might be a way for the charity to get some funding as well if there is this going on behind the scenes with the wellness side of things. So yeah, we're just coming together, aren't we? So we're looking at ways that
Absolutely.
can make it
absolutely, because at the moment it's very difficult to kind of, the whole point of this kind of call that we're doing is to get everybody on the same page. And it's like Dr. Gupta said, it's not about the case studies as such for the patients, but for people like myself who offer IV saline that don't do it out of financial benefit, we want to be able to do this for you free of charge, but we physically can't. So to get NHS funding, which we need case studies to be able to get that funding for, if we can get some money released from the NHS, very large pot of money that's hidden behind the scenes, which we all know is there, let's be honest, if we can get our hands on some of that money, fingers crossed, potentially we can look into prescription IV saline across the board for POTS patients.
But in the meantime, we want to make it available.
In the meantime, we want to make it available and we want to create that evidence.
Yeah. So can I just go back to some of the service users? We'll just start wrapping up now. I'm going to start with you, Rosie. How has this made you feel, hearing about these different things, that the difficulties, but the things that are putting in place and coming along to the event today? Just having the opportunity, I suppose, to come along. How do you feel? Because you're worried about coming today.
Yeah,
And you're in bed, aren't you? So...
I've got a chest infection as well, so I'm just like struggling to breathe as well. But it's made me hopeful. Like, it's kind of scary because they're, like, what if they start taking my prescriptions off me as well as the people that are already getting their prescriptions taking off them? That's like kind of very anxiety inducing, because like it's not very fair. Well, it's not fair at all that these people aren't able to access the medications that they need and that they've proved that work for them. But it's also made me hopeful about the saline and the, Dr. Is it Kumar, who's trying to set up something in like our area, to be able to help us. So yeah. Okay.
Well, thank you so much for coming along, Rosie, because I know you said, I'm probably going to be in bed and I'm not very well, and
I'm still in my pajamas.
Well, nobody cares. What about you, Ellie? How does it make you feel?
I feel very positive and I'm grateful for everybody and what they're doing.
Well, that's lovely. Yeah, I'm feeling very positive too. I mean, Bethany's jumped off because she's not very well, but I know she's feeling very positive too, and hopeful, quite excited, and I'm seeing things that she hasn't been able to do for a long time. And yeah, it is exciting. It's just making it accessible.
I think the big part, Natalie, is that somebody's believing.
Yeah.
Just to be believed.
Yeah. And this community, having some doctors here listening directly to the patients, and then having some specialists here and service suppliers here, and and just getting everybody together. Some good people out there.
I can remember the first phone call with Dr. Gupta. Ellie was sobbing and she come off the phone and she just went, he believed me. He believed me. He knew I was finishing my sentences. And that was massive.
Yeah.
Just to be that you weren't lying. It's not all in your head. It's real.
But the thing is, I still come across people who are at the beginning of the journey, and they're, you know, and they're at that stage where that they haven't met anybody yet who's spoken to them and they believed, and it takes me right back, and I think, oh gosh, you know, it's still happening. But I mean, we're lucky because we found each other, and you know, we're making some changes here. We're just
as a mum, it's so difficult. It affects us as well.
Of course it does. Yeah. So babies.
They are. And we'll fight for them.
I know. What about you, Melanie? How do you feel from coming on this and how we've been talking? You need to come on off mute.
You.
Yeah.
Sorry.
Right.
Any meeting I attend regarding the Hidden Disabilities charity is always a positive one. Just to know that people obviously are listening to us and advocating for us and understanding us, and also giving us a voice as well. I am worried that other patients and myself are going to be worried when they hear about the cuts of the medication. I think anyone is going to be worried about that. My head's working overtime thinking, are my medications going to be cut by my GP? Don't know whether Dr Gupta, I popped a little note on there. Are we going to be informed via a letter or a telephone call, or do we just assume if it continues, that's positive?
Yeah, I think, I mean, I think it's certainly in York, a lot of the GPs have turned around and started refusing it. But there are some really good people out there, you know, and some GPs are willing to make, and they say, I don't care about all that, you know, I see the difference it's made. So, you know, you just need to find the good ones, right? That's a challenge in itself. But you're very fortunate. You have a wonderful neurologist, and I think, you know, but the thing is, if you ever run into those problems, we are very conscious of that, and we will try our hardest to make sure that you don't come to financial disadvantage in trying to just wanting to look after yourself. I can't see. I mean, I think, you know, it's just a big fight that we didn't need on our hands, but you know, we'll certainly be there to advocate for you, I think. So I wouldn't worry. Well, what's going to happen is going to happen, but you know, we'll be there. We'll be there with you.
JJ, did you want to say anything to finish off?
No, I would say thank you, everyone. You know, I'd like to thank Dr. Gupta and Dr. Kumar, to be honest, to bring me around the table and explain the need of the hour. In a way, I think Dr. Kumar knows my passion about my patients, and that's how is got me involved in this, to be honest. So, and this is the same thing that when I have conversations with patients, Dr. Gupta's patients, I just want to make sure that, you know, they're looked after. And all I wanted to say is, you know, I wanted to extend my support by saying it's not just related to POTS medication that I'm there to dispense. If you have any other questions relating to medications in general, feel free to WhatsApp. I've dedicated a WhatsApp line purely for POTS patients. And if time permits, and if I can, then I might have an hour a week just to, you know, have that conversations with people to see, you know, you might not be just on these medications, you might be on something else and else where you might not receive the necessary support from your GPs or community pharmacists there. And I'll be more than happy to help, to be honest. So, yeah.
Do you want to put that information in the chat so they can access that?
Yes, definitely. I'll do that. Yeah.
Yeah. That's very helpful, and we'll be keeping in touch anyway, JJ, so that we can let people know how to contact you with about medication and things, and Dr. Gupta can help with that as well, can't you? So you can because they'll need to have the prescriptions, won't they, Dr. Gupta? Yeah.
I think it's important. The one thing I'd like to say is care is not this idea of care. Care is not something that can be cooked up by a committee one day. You know, care is not about people getting together and deciding what care should look like. Care is something we cultivate within our characters. And, you know, I'm so glad that I've met some very caring fellow professionals. And I think we all want to step outside of our comfort zone for our friends, our patients. I don't see these people. I don't see Ellie and her mom as my patient. I see them as friends. They enrich me so much more than they can imagine. And so this is a human connection we've developed, and we will try our hardest to make sure that we're with you all the way.
Yeah. And we believe you because we know you feel it. Dr. Kumar, did you want to say anything before we finish off?
Yeah, I think resources are limited. We all know times are hard, and especially for these patients, and our hearts are out for them. Whatever we can within our limits and within the times, and you know, being a busy GP, it becomes difficult. That though I want to do more and more, but whatever I can do from my side and within the hardest way, we will be there. And I'll try to work with Dr. Gupta very closely now, and see whatever I can contribute. So, no, I mean, within this area, if anyone wants to register with me, then that will be okay. I can. But the only thing is, if you are out of area, then we can't do the home visit. So, but within certain boundaries, if patient wants to register, for example, in Burlington or around, then that could be looked into. So that's what I can say, within my limits again, as I say. So yeah, I mean, I'll be working very closely. We'll try our best. We'll come out with more innovative ways. We will listen to the patient, their needs, their ideas, their way of, you know, so whatever we can make changes, we will.
Yeah, well, that's fabulous. We can't ask for more than that. I think
Natalie,
the next stage probably will be to have a bigger event with more doctors and get the resources there at an event as well. And that'd be something that'd be good to do next year, wouldn't it?
Natalie, can I just say one of the really interesting things was Dr. Kumar actually saw a POTS patient in his clinic who had attended, and he suspected it was POTS. So he did a video call with me at the hospital, and we did the consultation there and then. And that's how it should be, really. So that patient actually had a consultant review on their first visit to go and they see their GP. And they were started on medications that very day.
How good is that? It took 7 years for us. Oh, well, thank you so much, everybody, for coming and sharing your ideas and your experience and your you know, your skill set and everything. It's absolutely wonderful. I'm going to stop recording now, and we will share this so lots of people can get to see it.